All right, so next up is syphilis. So syphilis is caused by a bacteria called Treponema pallidum. Hey, that's not right though. Should be the same name, right? I don't really like that, but anyway, that's what it's caused by. So this is transmitted via breaking the skin or the mucous membrane, spread through the blood and lymphatic system. It can also be transmitted to the fetus through placental circulation. So that's called congenital syphilis, and again, it can be bad. Syphilis progresses through stages, and it can be fatal if it is not treated. So it's very important that we treat it. And this is the disease that kind of has some interesting history, just because it can cause, in the later stages, it can cause dementia. It'll kill you eventually, in a lot of cases, but it can cause dementia and stuff. And so, for many years, for hundreds of years of human existence, there was no cure. This is actually, if I'm hopefully not wrong about this history, but this is one of the few diseases that actually was transmitted from like the Native Americas to Europe. A lot of diseases like smallpox and things like that went the opposite direction, and it wiped out a lot of native populations in the Americas. But this is one that actually went the other way, where there were no, people in Europe, Asian stuff contracted it from the New World, and um, was kind of a new disease. And there've been a couple of historical figures and stuff where historians kind of suspect or question if they might have gotten syphilis and had been in stages of syphilis because of like how they started acting and that they died soon after and stuff for many years. It was actually a conjecture by a lot of historians that Robespierre or Maximilien Robespierre, I should clarify, because there's so many Robespierres out there, but of the French Revolution, might have had syphilis and towards the end of his life. But I think that's kind of been debunked, and historians don't really believe that anymore. But I think for a while it was a theory that he might have. But there's been some others as well, and again, just because of the way the disease works, but people didn't know that it was this bacteria because germ theory. It's really only been around a little while in the course of human history. It's it's kind of crazy to think about, but a lot of our knowledge of these things are relatively recent, right? So, no, y'all didn't care about that maybe, but I always find it interesting, and since I find it interesting and I determine what I think is important, I think it's important, so I'm telling you about it. But anyway, so as it said last slide, syphilis progresses through stages. So primary syphilis is the first stage. The only real symptoms you get of this is initially you develop what's called a canker sore and maybe some local lymph node enlargement. So canker sore, you can Google image search what that is, but yeah, it's just like it's a sore. You can get cankers from things that aren't syphilis as well, but yeah, it's what you'd see, and it's usually on the genitals. This typically occurs a few weeks to a month or so after the infection, as like you've had the infection transmitted. It's not painful, or if it is, it's like very minimal, but you are highly infectious at this stage. So again, it can be bad because you might not notice. I mean, if you look at a lot of canker sores, it'd be hard to not notice. But again, some people might not realize, and they don't have any pain or anything, and they continue to engage in sex with people, and they end up passing it around a lot. And that's bad because we don't want a lot of people to get it. After a while, so this is 6 weeks after the initial canker sore develops, you develop what's called secondary syphilis. And this is when most people seek treatment. Some people might seek it before, but a lot of people find it now because this is when the symptoms become a lot more noticeable. So you get a skin rash. The skin rash is pretty diffuse, like it can be all over your body. Um, can be in the mucus patches in the oral cavity. It can cause a sore throat. It's like the worst case of chickenpox ever. I say that probably most of y'all are too young to have actually gotten chickenpox. Got the vaccines, but as someone who was the vaccine wasn't really popular when I was a kid, I had chickenpox and I had a really bad case, and yeah, it was miserable. And this is what I imagine secondary syphilis is like. I don't know because I haven't had it, but I assume. So it's just a really bad rash all over the body, and then you get lymphadenopathy, so your lymph nodes are getting, really swollen. And then you get this thing called condyloma lata, which is wart-like genital lesions. So they look basically like genital warts. So again, kind of hard to miss at this point, but some people might not get treatment, but usually this is when people are getting treatment if they haven't already. So after, then we move into what is called tertiary or latent syphilis. And so this is important. Kind of like once you get after a certain amount of time, if you're not getting treated, you go one of two paths basically. So this can happen up to 2 or more years after the initial infection. You can develop what's called latent syphilis, which basically means the symptoms resolve and they remain gone after about a year, and they may stay absent for the rest of your life. Um, you never have any symptoms again. You're just living your best life. You are still infectious and you can still transmit it in this stage, but you're not suffering any of the long-term effects. And so again, that can be dangerous because there might be people that end up somehow progressing into latent syphilis, not realizing they had syphilis and they're passing it around to people. It can also, though, progress into tertiary stages, which can lead to very, very severe problems. Once they get in, if it doesn't go into latent syphilis and it goes into tertiary syphilis, it can cause what's known as benign late syphilis or the diffuse inflammatory response. So benign late syphilis means you still have symptoms, but they're more localized tumors, and it'll still respond to treatment. And it's just kind of like the symptoms are just kind of continuing, but it's kind of like you might just have like the condyloma lata or canker sores, but it's not really like as bad as like the really diffuse rash. However, it can also get into what's called the diffuse inflammatory response, which is way more insidious. It means that the infection gets really bad. It starts destroying your cardiovascular system and central nervous system. Again, it can cause dementia, it can cause death, or it eventually will cause death if it's not treated. It can cause cardiotoxicity and like your heart stops beating and you have a heart attack and die. So it's very bad. So we want people to get treated so they don't run the risk of that happening. So how do we diagnose and treat it? Well, it can be hard to notice early on for the reasons I mentioned. Once somebody comes in, we also can take a little while to figure out that they have it because the blood tests measure our antibody production, and that doesn't really ramp up until a few weeks after infection, right? So you get the infection, your body starts producing antibodies. Those aren't present in the volumes that would be indicative of infection until after you've had the infection for a little while, right? So it can take a little while to catch it. And so that's again another reason why sometimes it can be hard to treat. So how do we treat it though once we've diagnosed it? For all stages, just good old penicillin. Penicillin is the most common form. The length and the dose depends on the stage. If the person has a penicillin allergy or something like that, there are other drugs that we can use. But penicillin is the most common, just good old penicillin. Now, this is important. There is something that can happen when they begin the treatment called the Jerish-Hersheimer reaction. Because of the type of bacteria that syphilis is. It's a called a spirochete, if y'all remember from your microbiome, spirochete bacteria. So when these spirochetes start to die off, uh, the 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 cell walls or cell membranes. See, I'm forgetting my microbiome. I can't remember which, but one of the two is I'm pretty sure it's the cell wall. Has a lot of toxins to your body in it as they start to die, and so your body has to process them. So what happens is in the first day or so that you begin treatment, you can have some really bad symptoms that actually kind of almost look like sepsis. So we'll spike a fever really bad, get really bad pain, tachycardia, hypertension, which hypertension is not. I know we haven't gone over sepsis yet, at least if you're getting this in MedSurg 1, but you've probably heard of sepsis and are a little familiar. Usually we associate a low BP with sepsis, but in this case you'd see hypertension. So still signs of a really bad infection. Um, this is the Jerish-Hersheimer reaction. And it's the body responding to all these dead spirochete bacteria that they're processing. It usually starts within the first day of treatment and it usually subsides within 24 hours of starting the treatment. The treatment should not be stopped and it should not be slowed down unless the symptoms begin to be life-threatening. We just keep monitoring them and providing them comfort. So keeping them hydrated, giving them pain medicine, making them comfortable, trying to keep their fever down, all that stuff. We don't change anything. It's just good to be aware of this because if you see it, it might be scary at first and the person's going to be miserable. It will subside and it's part of the treatment. It's just part of the body responding to the treatment. So we don't need to change anything necessarily. Uh, we just got, keep on keeping on, trust the process, all that jazz. but just be aware of it and keep monitoring them because the symptoms could become life-threatening depending on certain factors. Maybe they got a lot of comorbidities or something. Um, but it shouldn't be a worry, but it's just something to be aware of because again, it might be a little worrying when you first see it, but it's nothing to worry about. Just again, keep monitoring them.